Moving on, we have our second keynote by our Health Revolution partner, OneSource Solutions International, on Keystone solution to achieve digital transformation and innovation in the Kingdom of Saudi Arabia through IoMT, cloud-connected medical devices and medical data governance, presented by Dr. Harold Arkoff, CEO of OneSource Solutions International. Welcome to the stage. The stage is all yours for the next 15 minutes, Dr. Harold.
Thank you so much. I hope everyone can see me. So I want to thank everyone for this opportunity. And I'm just going to say yesterday's session was fantastic and it ties in very nicely. But today I want to use this opportunity to expand your horizons of the possibilities of the future. Hopefully no one on this in the audience is too squeamish for what I'm about to show you. But I'm going to share my screen and show you what's on my phone here. Hopefully now everyone can see what's on my phone. And this is the future of telemedicine, connecting to all the medical devices you see behind me, video, waveforms, and data, allowing for the first time, real-time critical care telemedicine. You can pause it, rewind it.
I'm sorry to interrupt. We cannot see anything. There's a black screen. So
there's a black screen. Okay, well, we're just going to have to move on. Sorry about that.
No problem. Would you mind resharing your screen?
But at least you can hopefully see it on my phone.
Yes, we can see your phone.
Okay,
yes.
So having said that, let me just.
All good.
Okay, thank you. So my name is Dr. Harold Arkoff, and I'm a cardiac anesthesiologist with a background in biomedical engineering and surgery. And I'm taking a slightly different approach on my presentation today, but really it's about this Keystone solution to achieve digital transformation innovation in the Kingdom of Saudi Arabia through IoMT, cloud connection of medical devices, and something we call medical data governance. Hold on. Just trying to get my remote to work. So what is OSSI? We are experts in medical device data integration and medical data governance, transforming data into actionable informatics and connecting care providers to their patients in real time. What is medical data governance? It's the true source of normalized, validated, continuous data from many sources and devices into an AI-ready universal data set, transforming data into actionable informatics and connecting care providers to their patients in real time. So I want you to join me on a little journey and imagine what the future could be like, given technology of today, perhaps Google Glasses, Apple Glasses, and an augmented reality where all the data from the patient is presented to you virtually. The question is, if that's the future, what underlying technology or strategic infrastructure needs to be in place to bring all of this data together? So let me give you as an example. I live outside of Boston in a town called Sudbury. And the other day I brought up my phone and looked at the weather. This is artificial intelligence bringing together vast quantities of data to predict the future. That's artificial intelligence, and it gives you a likelihood or probability of an event to happen. Rain, snow, etc., or sunshine. Wouldn't the future be fantastic if, as a physician in the future, I go to the hospital and I get a weather report on each of my patients and a likely event to happen so I can focus my attention? That is the real future. But in order for that to happen, we need to be able to access the data. So what do I mean by this? So just imagine for a moment you're driving down the highway and you have the opportunity or the ability on your cell phone to connect to the dashboard of all the cars from all the different manufacturers driving on the road, and then simultaneously see the data from the engine performance. So the only way that's seen today is you go to your dealership and they plug in and they see all this data. If you were able to see all that data from all the cars on the road, wouldn't that be pretty incredible? Well, that's what OSSI has managed to do, to connect to all the medical devices in the hospital to accomplish this. So I'm going to hope that this works. And I'm going to ask if you have a cell phone to take it out and point it at the QR code. And I'm going to tell you that in a moment, you're going to see my heart rate, EKG. And you know what? I got up at 3 in the morning, had a double espresso, and I'm overdosing on caffeine, as you're going to see. So hopefully you've brought up on your phone, what you're looking at is a patient monitor and a pulse ox, and on my finger is a pulse ox, and hopefully in just a second, you're going to see integration between the EKG and the pulse ox on your own individual cell phones. All right, I'm going to take this off for a second, but you will see it on your own phone. This is true telemedicine, the ability to integrate a GE patient monitor and a Bluetooth device. And I hope that was effective. So what we specialize in is medical device interoperability, where data becomes actionable informatics. We connect all the devices you see in the hospital, including DICOM images, laboratory data straight from the lab, as well as all the medical devices and home, and bring it together into a single integrated database, seamlessly integrating live data to anywhere you're at, your smartphone, tablet, or workstation. So after hearing yesterday's lectures, I added this slide. And I realized, humans are social. We communicate and share information. That's our nature. But medical devices and equipment do not. OneSource elevates medical devices to communicate with humans, and soon vice versa. On a research basis, we actually have the ability to remote control ventilators. So this slide is something we call stranded data versus connected health via IoMT. Today, if you go to the ICU to actually see what's happening to all the medical devices in that room, each have their own individual screen. You have to physically go into that room to see everything that's going on from the patient monitor, the ventilator, and the infusion pumps. There is no interoperability. The biggest issue facing our future of AI and bringing all this data together is the lack of interoperability. What we provide is a platform on the right, a single integrated view, a single pane of glass, shall you say, that connects all these devices and synchronizes them in time. And this is a vast quantity of data. On the left, the status quo, the EMR cannot handle the vast quantity of data that we're talking about. Typical ICU on average collects 15 to 20 data samples per hour. We collect more than 1,500 data samples per second. Yes, that equates for 30-bed ICU, more than 4.3 billion data samples every 24 hours. And the entire infrastructure you see on my hand here. This is our IoT gateway that goes at each bedside. And the magic is off-the-shelf computer. That's $400 or $500. The magic is our software that runs on this inexpensive device. That makes this affordable, scalable, no expensive infrastructure that costs tens of millions of dollars. All right, our key technology is our edge computing. This is a multi-vendor, vendor-agnostic data aggregation system that can capture data down to the millisecond. It's an AI-ready and open architecture. What do I mean by that? The data is normalized and structured in real time from the patient's bedside. No longer is the EMR the true source of information. The EMR is just an adjunct to this larger data set. In terms of open architecture, this is an open design, not a closed system. We allow others, researchers and other vendors to join us and write drivers and software to layer upon this. So we have a product called OneSource Connect RMS, remote monitoring system. On the right is the status quo. You have very expensive central stations that collect all this data. You can install that, but most hospitals opt for what's below that. An IP camera that's $50 to $200, and an internet protocol keyboard video monitor that plugs into the central station, slaving that data remotely. You can actually just see the screen, but you lose the data. So I'm going to give you an example When you have access and control of all this data, what do you get? So just very quickly, this is the world's first ventilator-centric virtual central station that shows you what's happening with patients on a ventilator. You can do a deep dive into this, see the ventilator settings, flow volume loops from the ventilator, infusion pumps. You can see it in real time on your own cell phone. You can do a dive and see cause and effect between ventilator settings on the right, physiologic center values on the left, EKG with instantaneous beat-to-beat heart rate variability. We even have AI that will recognize up to 70 different arrhythmias. We can connect in as a gateway to the PAC server using a zero footprint process to actually bring up CT scans, do three-dimensional models, subtract out the soft tissue, and see the bony structures. This is critical in a level 1 trauma center. You can now take, this is an HTML page, believe it or not, it pulls together all of the data in a single view for the ICU, data from the EMR, the PACs, the medical devices, and gives you a single view, and this is completely customizable. No longer are we beholden to the engineers who are straight out of college to create a solution for ourselves. You know, as an engineer, surgeon, anesthesiologist, I view myself more like an Imagineer, like Walt Disney viewed all of his engineers. Imagine the future, create the infrastructure to make this all possible. So you can see that this is a single login for everything you need to manage the operating room. I want to move on to something we call medical data governance. All right, we're collecting, storing, and presenting data from medical devices for clinical research, hospital information systems, diagnosis, and education. We're bringing all this data together, but what's really more important is the metadata. So let's just take a look at the status quo. Source of clinical and medical data, the current approach, is a fixed location medical device. 99.9% of the data is just not preserved. Okay, it's just lost because the EMR was designed as a billing system. Then if you look at the spot or ambulatory patient medical devices, 90% of the data is not preserved. Who took it, when, what were the conditions? So we've created something new called medical data governance that brings all of this data together. So if I can move my cursor, we have a timestamp of raw data that's transforming into synchronized raw and normalized data that's ready to be analyzed, and then event association. So this could be alarms from the devices, it could be device data, it can be ICD codes from the patient, a whole host of other information. Just to explain the value of this very quickly, as an anesthesiologist, there's a famous study about anesthesiologist number 7 from 1985. This person had, their mortality and morbidity rates were 10 times that of their colleagues. And the question is why? When they looked into it, this anesthesiologist had more perioperative ischemia, and his patients subsequently did worse. More importantly, he had fewer caseload, had done fewer cardiac cases than his colleagues. So this is a knowledge deficit that led to that. So having all this metadata can solve a lot of problems for the future of augmented intelligence and precision medicine. So sort of in summary here, what we bring to the table is a bridge between the status quo and the future of AI, big data, precision medicine, advanced decision support, and create an open architecture and community for third parties to develop new software and medical devices, lowering or removing the structural barrier to entry, facilitating new advances. So why am I here speaking? Well, you know what? If you look at the entire world, there's only one country in the world where everything is in alignment to bring this type of technology to market for an entire country. Why? The Saudi Vision 2030 and the National Transformation Program established a set of national priorities, including digital transformation of healthcare. The Kingdom encourages partnerships with private industry to solve and transform healthcare delivery. This is a team approach. It's exactly what I do in the operating room. There's an alignment of will and means, or as someone yesterday said, supply, demand, and support. And there's alignment between government, policymakers, regulators, legislation, financial markets, private and public sector healthcare providers. Now, some relevant facts, as someone mentioned yesterday, the population is 35 million, yes, almost 36. The kingdom's earmarked $1.5 billion toward healthcare, IT, and digital transformation, so there's money and resources available. And the Ministry of Health wants to expand its critical care telemedicine program. There is a shortage of hospital beds in Saudi. By 2025, there's 10,000 bed shortage, and by 2030, 20,000 beds, and a nursing shortage. So there needs to be a way to facilitate this. Currently, 15 new hospitals are coming online in 2022 every year for the next decade in order to meet this demand. If you're building a new city, you need water, sewage, electricity. If you're building a hospital, you need an infrastructure that's cost effective, that takes data from the patient bedside and sends it to a national database. This is that infrastructure to make that happen. All right, our value proposition.
Dr. Harold, sorry.
Yes.
We are running past the time.
Oh, okay. Well then, in that case, I'm going to zoom past here. Think of the future. And you know what? If you put this in a bed, you can have an instant ICU anywhere. And I just want to thank everyone for this opportunity. OSSI is revolutionizing how healthcare is delivered. Please contact me, reach me to find out more information.
Thank you, Dr. Harold, for the insights and valuable knowledge imparted with us today. Dear audience, please feel free to visit the OneSource Solutions International booth and explore what they can do for your respective enterprises.
All right, thank you so much.
We have a video now being played.
Yes.
Health, the beating heart of your everyday. It's in every step of your journey, but no matter where your journey takes you, we are there with you. We collaborate with scientists, researchers, and hospitals to support doctors, surgeons, nurses, and caregivers across the world to give you the best possible solutions to improve your health. Innovation and you, Philips.